Good morning and happy Monday. I hope you're enjoying a fresh cup of coffee and that you're getting your week started. Let's talk through the top three things I'm thinking about in digital health this week. Here are the three things that are on my mind this week in the digital health space. I want to talk about what I saw at ViVE last week. There has been two crazy articles dropped, one on Glenn Tolman, the founder of Transcarent, among other companies, and then one on Hippocratic AI and the VCs backing that particular company. And then lastly, we can't seem to get away from politics. That's just the nature of our world today. And it certainly keeps coming directly into the digital healthcare space. So a couple of things that we want to talk about that we're seeing in the news and what that may or may not mean for founders, digital health companies out there in the world. So with that being said, before we dive in, I want to give a shout out. I picked up a couple of vinyls this past week. You may have seen John Batiste. If you were not familiar with him, he played and sang the national anthem in the Super Bowl. Won't blame him for the Chiefs crapping out a horrible loss in that particular game, but he did a wonderful job. I picked up this album. It's called We Are. He released it in 21. It won Album of the Year in 2022, and it is a wonderful, amazing, upbeat collection of songs that really just chronicles his experience growing up in New Orleans, his musical influences. Take a chance, grab it, play it on Spotify. It will give you a little pep in your step. But with that, let's talk about what I saw at ViVE. So I had the chance to go to ViVE this past week. It was in Nashville. I mentioned in our last episode we were expecting about 9,000 attendees, and it certainly felt like there were 9,000 attendees at this particular event. I've never been to ViVE before. I transitioned into the GovTech space back in 2017. ViVE was not a healthcare conference at the time, but it has certainly come onto its own along with health. It benefits from the fact that it is an extension of Chime, which is the organization that many, if not most, chief information officers across the U.S. from various health systems participate in, get training from, etc. And it was quite the fascinating event to attend for the first time and see what the content, the messaging was like in this particular engagement. So a couple of headlines or a couple of thoughts that I had going through it. So one, I had this constant observation of shiny, bright people. Now, some of this is the phrasing, the artwork, etc. The vibe. It's very, very loud colors, cartoonish pictures all throughout the conference, all throughout their website. I think it's a subtle, or maybe not so subtle, play at trying to get you in this upbeat atmosphere. But certainly that paraded through all of the events, and I think it actually kind of paraded through the mentality, the attitude that people had in the conference. So that was fascinating to see. I found that the content that I had a chance to participate in was actually pretty good. There were several sessions that I attended on value-based learning, on consumer engagement, on AI in healthcare that had some thoughtful observations or learnings. If there was a critique, if you will, it's that those sessions were incredibly short. Now, I think this is a design decision on the part of the conference. They were roughly about 20, 25 minutes, majority of the sessions anyway, and there's only so much you can get to. And I was constantly left wanting more, wanting to learn more about the process or the engagements or the things that these speakers had run into. But that being said, I still managed to take away net new things, things that I had not heard or things that I wanted to learn more about. And so I consider that a success. And then from a thematic standpoint, certainly there was a pretty diverse vendor presence on the floor. I was a little surprised not to see the most notable vendor out there, which is Epic. Did not have a presence at ViVE. Not having attended ViVE before, that may be a consistent thing for them. I certainly don't think that they're missing out. Everybody knows who they are. They don't necessarily need to go to the conference, but it was fascinating not to see them on the floor. That being said, as I walked around to every single booth, not a surprise, AI was front and center. and messaging around how their use of AI, whether they were a native AI company or not, was going to be the mechanism that would deliver value, save money, improve productivity, et cetera, et cetera. Um, I will suggest that look, there's a overwhelming number of companies out there, and they seem to come out of the woodwork every other day that is doing some level of ambient documentation. We hear about the big ones, a Bridge, among others. They actually just announced that they raised $250 million at a $2.5 billion valuation. But there were easily 10, 20 more that were at ViVE talking about the work they are doing in the ambient documentation space. So clearly that continues to be a hot space. I just really question, with so many choices, how do you pick the right one other than the one or two that you consistently hear in the headlines? Separate from the ambient documentation, I think the real story of this conference was this concept of agentic AI agents. And what that really means is there were a number of companies that were talking. I almost felt like it was just below the surface. So not so much that you felt like it was hitting your head every place you went, but you just saw it enough that you started to realize this was a trend line. But a number of companies talking about how they're helping, either building or helping to create AI agents that do a thing, and that thing can be done and or can trigger another AI agent to do a thing. And it just struck me that that was the almost under the radar consistent discussion or representation that you were seeing from vendors. I'm going to go out on a limb and I'm going to say I think this is going to be one of the biggest topics next year. It's actually going to eclipse the ambient documentation concept, if you will, and every single vendor is going to be talking about how they empower, create these AI agents, if you will. Now, we saw some headlines coming out of this. Innovacer, right? Everyone has seen Innovacer. They're one of the largest population health platform companies in the space today. They've raised a caboodle amount of money. They launched what they call a voice agent that is able to take actions and do things like help schedule appointments, collect information around chronic conditions, et cetera. They were not the only one. Another perennial population health company, Lamaris, launched their agent, which they call Tom. They refer to it as a virtual primary care agent that is able to be embedded within the workflow of a practice and not only help capture or guide specific actions that should be done within the four walls, but then do specific things to reach out, to engage the patient. We also saw companies like Notable talk about their AI store or their agent store where you could go build or pull down specific agents that could be launched to do specific functions from a population health standpoint. That's just scratching the surface. It seemed like every other vendor either were talking about how they were doing it or we're talking about how they were going to be doing it. So once again, I think this is going to be a hot topic fast forward when we come to ViVE next year. In fact, you may be surprised when we get to health at the latter part of this year, how dominant this conversation is within the confines of that conference, especially given how quickly this space is moving. A number of headlines that were coming out around ViVE or at ViVE. I already talked about a Bridge. They raised another $250 million. It just is a mind-boggling amount of money that they have to go build and continue to execute their business. One of the things that I noted as I was reading more about a Bridge and their raise and some of their history, they actually got their start as a consumer-first company. And I just found that pretty interesting. It's always fascinating to see the pivots that these companies take. But a Bridge originally started as building an ambient documentation tool that I, as an individual, would take an app on my phone, go into a doctor's visit, record that doctor's visit, and then distill it down so I would better understand how my healthcare was being talked about or actions that I should take, etc. I actually think that's a really great idea. I'm kind of sad that they pivoted. Not a big surprise that they figured out, hey, there's more money in health systems paying for documentation and taking that off of the shoulders of a physician than there is in trying to get someone like me to pay for it. But still, man, that would be pretty freaking cool. I wouldn't be surprised to see some similar type of idea come out along that lines. We saw any number of companies announce more ambient documentation. IKS Health introduced another AI scribe into the mix. Once again, it feels like there's 1,000 of these that are out there. I'm actually even starting to see ads for ambient documentation companies show up in my Instagram feed. I still am just really surprised when I see digital health companies targeting me as a consumer in my social media feeds, but there it is. That's when you know it's kind of broken through, if you will, to the mainstream. Um, Another company that has been around for quite some time has aggregated a number of different assets. Simpler, they announced that they are going to platform their company. What that really means is that they are really delivering a next generation platform built on AWS to link together all these operational assets. Will be interesting to see how that execution proceeds as they continue to go out into the market. Sword Health, who we talked about last week, announced a partnership with Highmark Health where they're extending their virtual musculoskeletal capabilities to focus on pelvic health. This is specifically with the Highmark Health plan. So I think it's approximately about 36,000 members that this is going to be offered out to. But hey, here's what I find interesting. Highmark is not just a health plan. They are also a health system. They're what you would call a pay provider. And I wouldn't be surprised to see companies like Sword that have been very good at selling these digital health services to an employer to start building on those pay provider relationships to extend into the care delivery side. More to come there. Will be interesting to see how that plays out, but that is one of the things I noted when I saw that headline. And then not a company that was at ViVE, actually kind of surprised, would have kind of expected them to be in a conference like this. But one of the bigger companies that's been in the headlines recently is a company called Function Health. It's a consumer-oriented digital health company that is meant to provide services, mainly a set of easy-to-order lab tests that then give you an assessment of where your health status is, and then some counseling and function along that. They're in talks to raise another $200 million. It still just blows my mind how much money is circulating in this digital health space, and speaks to what at least some people believe is the untapped consumer side of this marketplace. And I guess we'll see how this plays out. So those were my thoughts on ViVE. Will I go back? Probably. I'm really interested to be able to go see Health as a similar, almost maybe counterbalance to ViVE, but I hope that I'm able to get more involved in Chime, because I suspect you're going to get more in-depth content at an event that Chime's hosting versus the bigger side of that conference, which is ViVE, but remains to be seen. Once again, the two things really I look for out of a conference is I want to learn something new in terms of how to improve healthcare, whether it's access, affordability, quality, etc. And I want to have a pulse on where the market is going, what vendors are thinking about and talking about, and certainly felt like I scratched that itch with this particular conference. So let's move on to the second thing that I'm thinking about this week in digital health. And, given the amount of money that is being thrown into the digital health space, especially with all of the investment and energy around AI, it's not surprising that you're going to get a bit soap opera-ish in some of the rags and the publications that are out there. And so now I think we're moving big time into that space. There are two articles that dropped. Probably not the only ones that are out there, but two articles that dropped that caught my eye. One is a MedCity article. Go check it out. I'll drop the link in the comments. But this article focused on Glenn Tolman's founding and building of a company called Transcarent. That's his most recent venture. By the way, they've raised nearly $500 million and are valued at nearly $2.5 billion. So they've raised nearly 500 million. They're valued at nearly 2.5 billion. They've only been around since 2020, so they're roughly 5 years old. And the whole article focused on, is this a house of cards? Does the stuff, the tech, the capabilities that Transcarent talks about to help employers provide their employees better tools to navigate the healthcare system, which, as an aside, navigation is probably one of the things that Glenn would really push back on. Um, do they really work effectively? And so as you read the article itself, it was fascinating to talk not just about his prior investments. Look, Glenn is a towering figure in the digital health space. He helped take Allscripts public. He helped built and sold Livongo for one of the largest digital health transactions at nearly $18 billion to Teladoc. And now he's raised another $500 million to build and continue to grow this company, Transcarent. Just as an aside, when I first got into healthcare technology at Cerner Corporation, my first job was in competitive intelligence. I had responsibility for monitoring, assessing, and producing content around a number of different companies. One of those was Misys out of the UK. They got acquired by Allscripts, and I took responsibility for Allscripts. And I spent a lot of time researching what Allscripts was doing, how they were building their business, what Glenn Tolman had done within that organization. And I got a whole lot of thoughts that I won't share here, but it's interesting to see how that has transgressed as he's gone on to bigger and better things. So lots to pay attention here. Keep an eye on Transcarent. They're certainly a big name, but a couple of things that jumped out to me in the article is it talked about their tech not really being as good as they make it out to be. It talked about their growth not being organic, but more so built as they bought these little companies and then cross-selling back into those companies. Hey, not a bad strategy if it gets you the outcome, but it seems to me that that has a natural limiting step in terms of what your growth potential is. And probably the most, I think, alarming comment was that they were locked out of any number of RFPs, partly because of their perception in the industry, but partly because of how they compare to these other companies that have been competing in this space. Quantum Health, Included Health, Lantern, etc. Whether this article is right or not, it certainly positioned Transcarent as being behind the eight ball in terms of both capabilities and reputation compared to these other companies. So remains to be seen. Glenn Tolman, hard guy to bet against, but absolutely fascinating article. The other one that dropped. This is this is an article that dropped over the weekend last week by a gentleman named Sergey Polakov, and it's called Hypocritical AI, the fast track to becoming a main man in the healthcare mafia. Now, I'm not going to go through it, but what really caught my eye is a portion of this focuses on this company called Hippocratic AI and the background of the founder. He had a company, it went belly up, they declared bankruptcy, they left a bunch of vendors in the lurch, had a whole bunch of promises, and then many of those promises are being repackaged into Hippocratic AI. Look, I don't know what the true story is. This guy clearly has an axe to grind against both the VCs who have backed the company and this founder in itself. Here's what I do know, that Hippocratic is playing in one of the hottest spaces, which is patient-facing agents that are engaging using voice or conversational AI. I get really, really squirmish, though, in the language that this company uses around replacing nurses, or that they can do the job as well as a nurse. This technology is moving super fast, and there's a lot of ground to explore in terms of the right role that AI agents will play in terms of engaging patients. But I just don't feel comfortable with how they think or talk about this stuff. I would like to see a little bit more nuance. I'd like to see a little bit more, I don't know, credit to the role that a nurse plays in patient engagement and patient health, and how this is an augmentation and extension, not a replacement. That doesn't have anything to do with the article, but go read it because it is a good read. It will get your blood rushing one way or the other. And it's absolutely fascinating from the cheap seats to see what may or may not be going on behind the scenes. So here's the third thing that I'm thinking about this week. Once again, the counterweight. We are not a political podcast, but politics comes into play every single day in healthcare, especially if you're building a company or you're thinking about starting a company. Because of the nature of how healthcare is paid for and delivered in the US, you have got to be mindful of politics and policy. for any number of aspects of areas that you may start in healthcare. So first and foremost, I'm not going to talk through every single headline that's coming out of this administration. It's like an avalanche. You can't keep up. That's probably intentional. It wears me out. But here are some of the things that have broken through. One, the administration, and specifically the president, has endorsed a House budget bill that would cut over 10 years $880 billion out of Medicaid. Now, that's a big number. We spend a lot of money on Medicaid, but that's spread over 50 states plus territories. It supports over 80 million Americans. And I've seen some estimates, I've seen some people say that Medicaid covers 1 out of 2 births that happen in the United States. It is almost overwhelming to think about how many people are actually impacted. And I would go so far as to say impacted for the better because of Medicaid providing access and payment to healthcare services, and not just hospital and not just primary care, but dental, to behavioral health, to specialty services, etc. So whether or not you like Medicaid or not, whether or not you agree with what this administration is doing or not, what you do need to be aware of is that there is a train coming down the tracks that is continuing to build steam to take a lot of money out of these programs, which means that these programs are going to get smaller. It means that states are going to be more responsible for the amount of money they spend, which in many cases is going to mean that they won't spend money on these programs. And if you're building companies that focus on that population, an underserved and important population, then you've got to be thoughtful about what your financial model is, because if you're dependent on federal funds flowing down into these programs, you're going to come out on the short end of the stick if you're not thinking forward to other alternative financing mechanisms as you build your business. Now, that being said, I hope that this changes course. I've seen the benefits that people derive from having access to healthcare, especially the populations that typically are receiving care from Medicaid. You may not be aware, but Medicaid is one of the greatest innovation engines in terms of new healthcare delivery mechanisms within the United States. It's a great tool for experimentation across all of these different states and how you can do more with less, if you will. But remains to be seen. Here's the other political surprise, and I feel like that's trite to say because every day comes with a surprise. But here's the other political surprise. Evidently, there was a headline that came out that this administration is going to actually not renew the telehealth waiver that's coming to an end at the end of March. And I got to tell you, this shocks me. Of everything that shocks me coming out of this administration, this surprises me because it is one of the things that you've heard people in the administration, especially the gentleman nominated that's now leading Health and Human Services, RFK Jr., talk about the role of technology, about improving access to primary care, about focusing on improving chronic conditions. And you've even heard some very positive statements about the role that telehealth plays in that endeavor. So to juxtapose those comments and now say that they're not going to renew the waiver, not only does that seem in conflict, if you're a founder, there's any number of digital health companies that have built a model around some aspect, if not wholly, providing telehealth or virtual health services to provide to consumers. So what's that going to mean for those business models? I think we're about to see an earthquake ripple through the digital health community between funding cuts in Medicaid and to some degree Medicare, between things like the telehealth waiver not being renewed. It's going to be a reset on the type of services that digital health companies are building. And once again, if you are thinking about building or you're building today and you provide telehealth services and those health services are reimbursed by Medicaid or Medicare, then you need to be thinking about what's my alternative? How do I build a plan B? Because you're going to have a rude awakening come the end of March when this extension is not renewed, if the administration follows through on this particular promise, and what that means for your business. Lastly, this seems like a small thing compared to all these other things, but amongst all of the headlines about layoffs across the federal government, these people being cut, those people being cut, some people being brought back, one of the headlines that caught my eye as it pertains to digital health is that within the FDA, they laid off their AI and digital health employees. Um, like, I don't have a lot to say about this other than there is a tremendous pace at which AI is developing. I would argue there is a benefit to creating structure and regulation around how that then ultimately is used in healthcare. And so whether it's the FDA or some other agency, them being thoughtful about how to evaluate these tools and then certify or put them out into the marketplace will serve us well. Not having people who do that will not serve us well. Remains to be seen. It certainly feels like the wild, wild west out there. So with that being said, those are my top three things. Really enjoyed ViVE. A lot of headlines coming out of it. Um, Absolutely fascinated by these down and dirtied articles that are being published. The one on Transcarent and Glenn Tolman, the one on Hippocratic AI and his VC backers. And then lastly, every single day brings a new revelation about what's happening in the political sphere. And as a digital health person, cannot be blind to it. There's so much of our funding in healthcare that comes from either federal or state agencies that you need to be thoughtful about what these changes are going to mean. I'm going to make one more plug as we come to the end. I talked about John Batista's We Are record, once again released in 2021. If you want to listen to another one by John Batiste, this is another great one, Anatomy of Angels. This was recorded live at the Village Vanguard in New York. I promise you will enjoy it. It's a 45-minute endeavor. Get to the weekend, put this on Spotify, get a nice bourbon, maybe an old fashioned, let it play in the background, close your eyes, think about the music. It will reset your day. All right, these are the three things I'm thinking about this week. Drop me in the comments what is catching your eye, and I look forward to having more conversations with each of you